Welcome to Review Central. This is NCLEX Reviewer No.3, featuring questions on health promotion and maintenance. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN, or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Shall we begin? Question number 1. Select the factor that greatly increases risk of ischemic stroke in females with migraine with visual aura. A. Hypertension. B. Diabetes mellitus. C. Oral contraceptives. D. Hyperlipidemia. The correct answer is C. Oral contraceptives. The Stroke Prevention in Young Women study evaluated women ages 15 to 49 with ischemic strokes. Migraine with visual increased the risk of ischemic stroke without other conditions usually associated with stroke. This risk was increased by oral contraceptives and smoking cigarettes. Females with migraine with visual aura who smoke and take oral contraceptives have a 7-fold increased risk of ischemic stroke. Question number 2. A 65-year-old male is hospitalized for pneumonia. When the caregiver enters the room, he tells them to leave him alone. Select the best response. A. Why are you angry? B. I will come back later. C. Can I ask what is wrong? D. I take it you are not feeling better. The correct answer is D. I take it you are not feeling better. The caregiver should validate the patient's behavior but ask an open-ended question. Assuming the patient is angry or not feeling well would not be the best choice. Offering to come back later does not improve communication. Question number 3. Victims of human trafficking rarely self-identify. As healthcare providers, we need to look beneath the surface for clues. Which of the following is not a red flag or indicator of human trafficking? A. Under the age of 18 and involved in a commercial sex act. B. Has tattoos or brandings, often sexually explicit or ones that imply ownership. C. Has in their possession identification such as driver's license or passport. D. Avoids eye contact, nervous, and fearful of touch. The correct answer is C. The question is asking which is not a red flag. Except for C, all the other answer choices are red flags. Human trafficking victims are usually accompanied by a controlling, in-your-face significant other or family member. The trafficker has possession of all forms of identification such as a passport or driver's license. Often a customer service representative or intake person may be the only staff member that witnesses this exchange. Therefore, education should include these support staff. Anyone under the age of 18 and involved in a commercial sex act, force, fraud, or coercion do not need to be present in the case of a minor. The reason being twofold: it is easier to exploit and manipulate a minor. According to the Victims of Trafficking and Violence Protection Act of 2000, a commercial sex act means any sex act on account of which anything of value is given to or received by any person. This can include sex, drugs, transportation, food, clothing, or anything needed for survival. A victim may refer to the trafficker as a boyfriend or daddy. They may have a tattoo that is sexually explicit or implies ownership in their hairline, neck, chest, or pubic hair. A provider may be quick to stereotype if a patient is a prostitute, stripper, or homeless. Stop, observe, ask, and look beneath the surface. Question number 4. The United States Preventive Services Task Force, or USPSTF, does not recommend a cholesterol level screening for which of the following patients? A. 57-year-old smoker. B. 56-year-old diabetic female. C. Average risk 25-year-old male. D. 47-year-old with a family history of coronary disease. The correct answer is C. Average risk 25-year-old male. The United States Preventive Services Task Force, or USPSTF, strongly recommends screening men aged 35 and older for lipid disorders. The USPSTF also strongly recommends screening women aged 45 and older for lipid disorders, if they are at increased risk for coronary heart disease. Therefore, the patients described in A, B, and D are all recommended for screening. Meanwhile, the USPSTF also recommends screening men aged 20 to 35 and women aged 20 to 45 for lipid disorders if they are at increased risk for coronary heart disease. Question number 5. The auditory eustachian tube connects the nasopharynx with which of the following? A. Vestibule. B. External ear. C. Middle ear cavity. D. Tympanic membrane. The correct answer is C. Middle ear cavity. The auditory eustachian tube is also known as the pharyngotympanic tube. It connects the pharynx to the middle ear. It runs from the anterior wall of the middle ear to the lateral wall of the nasopharynx. The portion by the ear is comprised of bone while the rest is cartilage. It serves to equalize pressure and drain mucus. Question number 6. What is a good way to know the baby is getting enough milk through breastfeeding? A. Infants should regain birth weight by 2 weeks. B. 5 soaked diapers a day should be seen. C. An infant sucking from a bottle should be compared. D. If a newborn is nursing 6 to 8 times a day. The correct answer is A. Infants should regain birth weight by 2 weeks. A newborn should be nursing 8 to 12 times a day, with multiple soaked diapers and frequent stooling. As a guideline, an infant should regain birth weight by 2 weeks. The action of the infant's tongue is different when sucking from a bottle or pacifier than from the human breast. Question number 7. A 2-year-old child living in a residential institution for developmentally disabled children should receive all of the following vaccinations for prevention of infection, except which of the following? A. Hepatitis A vaccine. B. Hepatitis B vaccine. C. Pneumococcal conjugate vaccine. D. Meningococcal vaccine. The correct answer is D. Meningococcal vaccine. Children living in residential institutions should receive all the routine childhood vaccines. In this setting, children as well as staff are at increased risk of acquiring hepatitis B virus infection. Outbreaks of hepatitis A virus infection can occur in residential institutions. The routine vaccination of all children 1 year of age and older is now recommended. Hepatitis A vaccine, in addition to immunoglobulin, should be considered for staff and residents in an institutional setting where an outbreak of hepatitis A is occurring. Pneumococcal conjugate vaccine is a pneumococcal vaccine and the conjugate vaccine used to protect infants, young children, and adults against disease caused by the bacterium Streptococcus pneumoniae. On the other hand, meningococcal vaccine is recommended for adolescents and adults, ages 11 to 55. Question number 8. What approach does the Department of Homeland Security's Blue Campaign recommend when having contact with a potential victim of human trafficking that is vital to providing care delivery in a compassionate, culturally sensitive, language or linguistically appropriate, and non-judgmental manner? A. Problem-oriented. B. Victim-centered. C. Prosecution-friendly. D. Law enforcement-centered. The correct answer is B. Victim-centered. The victim-centered approach, adopted by the Department of Homeland Security's Blue Campaign, is defined as the precise focus of attention catering to the needs of the victim to ensure delivery of care in a compassionate, culturally sensitive, linguistically or language appropriate, non-judgmental, and caring manner. A victim's wishes, safety, and well-being are considerations. The heart of a victim-centered approach is to interact with the patient in a manner that will prevent re-victimization or re-traumatization. Trauma, as it relates to an individual from an initial insult, is a series of events or stressors that the individual experiences either emotionally or physically life-threatening and has lasting ramifications on their social, physical, mental, and spiritual well-being. Care of survivors of human trafficking must involve a trauma-informed approach. A healthcare provider must recognize the scope of the impact of the trauma on an individual patient's lifespan and lessen any chance of inflicting more injury. The healthcare provider must understand the signs of trauma, verbal, and nonverbal cues and respond by following predetermined protocols for identification, treatment, and appropriate referrals using an interdisciplinary and collaborative approach. Question number 9. You have been practicing with your stethoscope so that you can become good at identifying murmurs. Which statement is false about an innocent murmur? A. Usually soft and may occur in both adults and children. B. It is associated with the normal first heart sound. C. The murmur may be crescendo-decrescendo in nature. D. Diastolic murmurs usually do not require any workup. The correct answer is D. Diastolic murmurs usually do not require any workup. The question is asking which statement is false about an innocent murmur. All the other answer choices are true about an innocent murmur. All diastolic murmurs need workup. Diastolic murmurs are often associated with cardiac pathology. Question number 10. A new mother is told that her infant has tested positive on a newborn screening test. She later learns that her child has phenylketonuria or PKU, and will require a very specific diet because he is missing the enzyme, phenylalanine hydroxylase. Into what does this enzyme convert phenylalanine? A. Glutamate. B. Dopamine. C. Epinephrine. D. Tyrosine. The correct answer is D. Tyrosine. Phenylalanine hydroxylase is the enzyme responsible for converting phenylalanine to tyrosine. Children with PKU must follow a strict diet to avoid the accumulation of phenylalanine and other harmful related substances. Normally, phenylalanine can be converted to tyrosine, which can undergo other subsequent reactions to produce dopamine and epinephrine. You have just completed NCLEX Reviewer No.3, which featured questions on health promotion and maintenance. If you wish to watch more NCLEX reviewers on health promotion and maintenance, check out our NCLEX Health Promotion and Maintenance Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful, and feel free to share it to anyone who may also benefit from it.